107.9. Orange 107.9. Orange 107.9.
Hello, it's 9 minutes past 8 o'clock here on 107.9 Orange FM. Welcome to the Orange Health Lounge. My name, as always, is Dr. Kwesi Jima. All my guests are seated, and today we have an interesting discussion for you. The Orange Health Lounge comes your way every Saturday between the hours of 8 a.m. and 10 a.m. and we bring you insightful conversations about healthcare. Our show is brought to you by the kindest courtesy of Prime Diagnostics and Eye Care Services. Prime Diagnostics and Eye Care Services is located here in Kumasi at Bomso, and they offer a wide range of laboratory care services. They do liver function tests, renal function tests. They offer full blood counts. They offer genetic testing. They do screening for cervical cancer and prostate cancer. They also do counseling services. Prime Diagnostics and Eye Care Services is able to come for your lab in your home or your office and send your results to your preferred prescriber. You can locate them in Bomso here in Kumasi, or you can call them on 0243-360-282 or 0202561234. Prime Diagnostics is your number one medical laboratory here in Kumasi. guests are here, and I guess I need to start with the ladies first. My guest this morning, Marilyn Mausi Azuma. She's a nurse at the Komfo Teaching Hospital, and she's a member of the Sport/Fast Foundation. I'm going to ask them what they do shortly. I also have Patricia Osei Owusu. She's also a nurse at Komfo. And then Mr. Patrick M. Camilo. He is the acting chairman of the Sport/Fast Foundation. He's also a nurse at Komfo Teaching. So this morning we're having a conversation with nurses at Komfo Teaching Hospital, which I haven't been in over a decade, but it's all good. I haven't been in a long time. Anyway, good morning, guys.
Good morning.
Good. It's good to have you here in studio joining us for the Orange Health Lounge. Anyway, so let me start with your chairman, Patrick. What's your foundation all about? Sport/. I have to say it slowly. I have to say it slowly. Sport/Fast Foundation. Yeah.
So Sport/Fast Foundation is an organization where it comprises of healthcare workers, mainly nurses, and other volunteers. Our core responsibility is to educate the public on stroke preventive measures and stroke management after having a stroke. The dream came up when we were working at the stroke unit in Komfo. So we realized that the incidence of stroke cases is on the rise, and among them were the youth. So it was quite a concern for the staffs working at the unit. So we keep asking ourselves, what happened? Because some years back, we used to see stroke among the elderly people, and suddenly the youth is involved. And we realize that it's lack of information. They don't have knowledge about how the condition is all about and some of the preventive measures they could put in place. So we decided to volunteer ourselves and go out there and spread the information, let people know that the condition exists, and then clear some myths they have about the condition. So our ultimate goal is to get people to hear about the stroke and know that it's real. It's not something, a lot of people have perception. And one of the myths is that it affects mainly the aged.
The elderly.
Yes, the elderly people. But today we know that everyone could have a stroke. Even yesterday I interviewed a stroke survivor, and she was surprised to see a 4-year-old boy having a stroke, and I survived it for about 5 years now, which means that everyone could have a stroke. So with this, we decided to go out there and spread the information to the people and help control the rate at which the condition is occurring.
I mean, that's interesting because when it comes to healthcare, I think the word is advocacy. You do find that a lot of people are not really bothered, especially about things that are not, about non-communicable diseases. I mean, I think all of the time our focus is on communicable diseases, and we have a lot of foundations and interest groups for that. But for you, Marilyn, are you at the stroke unit now?
Currently, I'm at the D4 ICU at Komfo. Yes, but I used to work at stroke.
When people hear D4, they think about a lot of stuff. But I mean, so you're all involved in just raising awareness about stroke and stroke prevention, isn't it? And how to spot it, right?
Yes, please. Yes,
okay.
Please.
But how has it been for you since you guys started?
It's been very progressive. We've been going to churches, marketplaces, and also wherever we get the opportunity, we create the awareness on stroke. And also, whilst creating awareness, we do free screening for people in the communities. So it depends on where we have the opportunity. If it's the church, we talk about stroke. Then when we talk about stroke, we do free screening. So we check their blood pressures because it's one of the indicators for stroke, someone with a high blood pressure. And when we notice that the person person is having a high blood pressure, we refer them to the clinic and we do a follow-up on them. So Spot Stroke Fast Foundation does a follow-up on the patients or the people who come for the screening.
Okay.
Again, sometimes with patients, people who are admitted to the hospital, we also do a home visit to teach the relatives how to care for stroke patients. So we give them that kind of support because it's not easy to have stroke.
So it's not just about raising awareness. You do all the pathways of care for the patient. And I think it's a very interesting thing that this whole conversation or this whole activity is being nurse-led, because you spend much more time with the patients and you see all the dynamics that has got to do with the family, the person themselves, and the changes and the difficulties that they go through. So, Patricia, you're also with the foundation, and you're also a nurse at Komfo-Anokye.
Yes, please.
When you do these activations or these awareness creation and home visits, what strikes you? You know, because a lot of people, I always say that when you have a stroke in a family, it affects so many people than just the person who has the stroke. What strikes you when you see these people?
Okay, so first of all, it starts with you, the individual, then it moves to the family, and then those outside. You can't just go outside without first looking like to yourself, then your family. What actually struck me to join this foundation was, of late, one of my family started complaining about numbness in his arm, and I didn't pay much attention to it, but I was part of the organization. And then it pricked my mind one way or the other to really focus on what he was saying. That was when it came, some of the symptoms. Later on, we'll be talking about some of the symptoms of stroke. Then that's actually pricked my mind to pay attention to the relative that was so close to me, that if you don't pay much attention to it, we're saying that we are health professionals, and then we're just looking outside, but not starting from the house or the home that we are. Later on, we realize that we are helping those outside and then neglecting we ourselves or our family. So that was one of the things that pricked my mind to join the foundation, and also helps to create more awareness. So when I see that the public are getting more knowledge about stroke, I see it as a way of helping you personally, the family, and then everyone, because one way or the other, if you don't inform them or they don't get the knowledge, it's going to be a burden onto all of us. So that's the more reason why.
I mean, that's interesting, because stroke or CVA, I mean, we're going to say stroke, we're not going to say CVA, but people are going to get confused. So if you're just tuning in, this is 107.9 Orange FM, and this is the Orange Healthland. Forgive my tired voice this morning. The Orange Healthland comes your way every Saturday from 8 to 10 a.m. And on this show, we break down all the complicated healthcare conversations, and we make them sound so simple for everybody to understand. Our show is live on Facebook, and we're also interactive here on WhatsApp. You can send me a WhatsApp on 0548 501 584. If you've got a question about anything that we're talking about, you can definitely send me a WhatsApp on that, and I'll answer it for you. You can send even a voice note, and we will play it for you. The number is 0548 501 584. If you're watching us on Facebook, you can also drop your comments there, and we will definitely read it out for you. Our show is brought to you by the kindest courtesy of Prime Diagnostics and Eye Care Center, located here in Kumasi at BOMSO. Call them on 0243-360-282, and they can definitely sort you out. So, I mean, we've been saying Spot Stroke Fast and what stroke is and everything. For someone who is listening to us for the very first time, and, you know, we all hear stroke. Oh, this person has got a stroke. Oh, that person has got a stroke. And if you drink that, you get a stroke. I mean, people have so many misconceptions about strokes. What is a stroke? And I mean, any of you can answer, or all of you can answer it. You understand? So when we say somebody has got a stroke, what really are we talking about?
So when you say stroke simply means that there's interruption of blood supply to the brain. Stroke occurs in the brain. So once there is an interruption of the blood flow to the brain, we classify that as a stroke.
Okay.
So it's either the blood vessels carrying the blood to the brain is blocked, or the blood vessel ruptures. Ruptures means it breaks and then the blood leaks into the brain or around in the brain. So when this happens, the parts away from the point where the destruction occurred dies, and it's irreversible.
Okay.
So when it happens like that, it means the person has suffered a stroke. The manifestations are seen on the extremities, especially the arms, the face, and then the legs.
Okay.
So typically, most people are of the view that stroke occurs in the hands and then the legs, but actually, it's in the brain.
Okay.
And it's seen as a medical emergency, because if it happens and you don't rush the person to a healthcare facility and you delay, it means that the damage progresses and the chances of recovery minimizes. So stroke is a condition that strikes in the brain.
So if I'm hearing you, it means stroke happens in the brain and then it manifests on all other parts of the body,
Yes.
more or less.
Yes.
Right?
Yes.
But Patricia, that's a bit strange, isn't it? That you have an event in your brain and then it translates down to somewhere which is completely unrelated. How do you explain that to the people who may have had a stroke?
It's just wonderful. That's the creation of God. Looking at the body, and the brain controls every part of the body. So what happens is, based on where it was affected, that is when it will manifest. Okay. So if the effects and also it depends with the kind of stroke. At times it might be a local kind of damage. At times it may be something big or a general kind of damage. So if it's a local damage where it actually happened or it's affected, that is when you're going to see the results. So if it's affected the part of the brain that controls the muscle for movement, it's going to manifest in the arm. So if it affected the right kind of brain, it's going to manifest in the left arm. That's how the brain works. So it manifests in the opposite side. So if the person is not able to maybe move the left leg, that means that it affected the brain that controls the right. I hope you are following. It affected the brain that controls the muscles that controls the left side. So it acts in the direct opposite side.
Okay.
That's how it says.
That's how it acts. But
yes,
you know, one of the Marilyn, one of the things that people always say when it comes to stroke, you know, I mean, I think we've seen strokes in the elderly, so we are tempted to believe that when you grow old, you definitely get a stroke. When you grow old, you definitely get a stroke. But in your intro, you talked about young people getting strokes. Like, what puts people at risk? Like, what are the risk factors? If somebody's listening and the person is worried about, okay, is there something that I'm doing that may put me at risk of getting a stroke, or that potentially could make me get a stroke? Like, what are the risk factors to getting a stroke?
Thank you very much. So when it comes to the risk factors, there are ones that we can't control, such as the age. So age, gender, and also family history. So if there is a member of your family that has had a stroke before, whether it's your mom, whether it's your grandpa, there's a tendency of you having a stroke. And when it comes to the other part that we have control over, that's the lifestyle modification. So when we talk about the lifestyle modification, when you're obese, when you're overweight, there is a high risk of you having a stroke. When you're having a high blood pressure, that you're not taking your medication, so it's not well controlled, there is a high risk of you. You have research shows that you have 70 times of having a stroke. Then when you have diabetes, you have a tendency of getting a stroke. Apart from diabetes, when you are over drinking alcohol, heavy drinkers of alcohol, and also use of aphrodisiacs, and also use of overuse of oral contraceptives. So that, yes, please. Research has shown that.
You know the aphrodisiac comment. someone already sent it to me even before the show started. That it's one of the things that I think people really would like to clear it up, and find out even if it's true, because from what he said, and I tend to agree with him, 80% of our adverts on radio are, well, not on this radio. We don't do that here. 80% of adverts on radio stations is about an alcoholic beverage, which at the same time can boost your sexual prowess and make you a man in bed. Only God knows what that means. And will give you extra energy. And these things are just, aphrodisiacs that are masquerading as something else. And his question was that if these things cause stroke, why are we allowing them to be on in our faces and in our ears constantly? Like almost every day there's a new brand out, there's a new something out. Like, is there any truth in the fact that some of these, not all, some of these drinks can cause strokes?
Yes. Sports Stroke Fast Foundation, we've been having this question most often. Yes, there's truth in it. People always ask that why if we are saying these things predispose people to having a stroke, why do we allow it to be marketed or aired on radio and on TV? We have people who control an institution, who control these products. Perhaps their research says that a certain volume or a certain amount is therapeutic for an individual. But if you misuse it, and then you have the untoward effect of it, that one you can't fault the institution that granted the permission for the sale of these substances. That's why we say that excessive intake of these substances will predispose you to having a stroke. So if you are abusing alcohol, a lot of guys a lot of people, the perception that when they take alcohol, they feel okay, they can sleep, they can eat well, they can, be a man in bed, as they always say it, and stuff. But you realize that when you have a risk factor, just as Marilyn mentioned, if you have hypertension or you have a family history of hypertension, diabetes, and you add on these things, the little you add complicates the existing problem. I've heard a lot of people say that, oh, but I just took 5% of beer, and the whole bottle is 5%. It doesn't work like that. The standard you can take is 2 drinks a day for men, and then a drink a day for men. A drink simply means that when you are taking 5% alcohol, what it means is that you are supposed to take 12 ounces as a lady or a female, and then about 24 ounces for a male. What it means is that 1 ounce is 30 mils. And when you take 5%, every 100 mils of the alcohol you take or the drink you take contains 5 grams of the alcohol like you've taken. So if you take a beer, for instance, assuming it's 300 mils in all, and then you consume everything, and it's 5%, what it means is that you have taken 15 grams of alcohol. That's what, carried people away, because they perceive the entire bottle to be 5% or 5 grams of alcohol that they've taken. So you realize that if you are a female, the standard is about 12.5 grams. So if you consume the entire 300 mils of beer, which is 5%, what it means is that you have consumed the required, or the acceptable volume of alcohol in a day. So people go to the pubs, go to the sports, and then they will drink about 3 bottles or 5 bottles, and then they'll say that, once it's 5 bottles, then I've taken 25% of alcohol. It doesn't mean like that. Once you finish one, it means that you've taken almost 15 grams, which is more than the normal threshold in a day for a female. A male can take twice of that. So that's where the abuse and the misuse is.
Mm-hmm.
So that one, you can't fault the institution that gives permit for the sales of these things.
Okay, so then I think that there's more to this conversation about alcohol or excessive intake of alcohol and stroke, in the sense that the responsibility is on you, the person who is drinking it, isn't it?
Yes.
Because if, well, the alcohol there is there, and you have to sort of know, like reason, like, you know, like know your limits.
Yes.
You know, like you should know your level, right?
Yeah.
Yeah.
So typically that's where the problem is. Because, you know, a lot of people don't know what goes into alcohol and the volume you can actually consume, which, if you don't have any risk factor or you don't have any underlying medical condition, will be safe for you. But once you have a medical condition, it means that the little you take, it compounds the situation. That's typically what it means. But how many of us knows whether we have any underlying condition? We don't check our blood pressures to even see the levels of it. We don't know our cholesterol levels. We don't know whether we are at risk of having diabetes. But yet we consume alcohol, and alcohol is seen to, facilitate these chronic conditions, like having a hypertension, for instance. Other people too say that with the alcohol, they are not, they take it on, occasionally. Just that their occasions are frequent. So you can imagine, okay, so you have a naming ceremony on Sunday, you have a funeral on Saturday, on Monday or Tuesday, you have
Patrick, you see, as occasion, anything can be an occasion.
So what happens?
Even if it doesn't rain today, it's an occasion.
Of course. So, sometimes it becomes a challenge. But then, as we keep educating people, we tell them that this is, what they can do. Sometimes it's difficult. And we know it's difficult to teach an old dog a new trick. But when we take it upon ourselves that, we are going to be the sole managers of our own health, and then we'll desist or reduce certain things we do which may worsen the situation going forward. It means, we may be safe, and then the hospital will not be overwhelmed with stroke cases, and the family will not be burdened as well.
All right, if you're just tuning in, this is 107.9 Orange FM. We're 33 minutes past 8 o'clock here on Kumasi's Music Leader, and this is the Orange Health Lounge. We're talking stroke this morning. If you've got a question about stroke, you can send it to us on WhatsApp on 0548 501-584, or if you're watching us on Facebook, you can drop your question in the comment section like Kalito has just done. And he says that I learned some, we'll come back to the risk factors in a bit, I haven't forgotten. I learned some sexual acts can also cause stroke. Can you elaborate on that for me? I don't have any answer to this. So, is it true? No, because it's something that you hear a lot. Like, educate me in the mindlessness. Any of you, all of you.
The person wants to know,
I think the thing is that people say that there are certain positions that reduce blood flow to your brain, and that causes you to, I don't know.
You know, that's why we talk about the aphrodisiac. If you're looking at research that has been done over the years on aphrodisiac, you realize that this aphrodisiac, yes, even though it may enhance your erection ability, but then the ripple effect is to drop your blood pressure. As it's dropping, your pulse rate will also increase in a way. So when it happens this way, the supply to your brain reduces. But as to the position, yes, I also read on the position recently on social media that when you do some, they call it some name. Yes, it may be possible. Because
it may be possible.
We can't just, say it is. But, if you are in the act and you are having headaches and you're having dizziness, it should tell you that something is wrong. So you may have to advise yourself, especially when you have taken a sexual enhancer.
Okay.
To enhance your performance, and you start experiencing headaches. In fact, there was a man who was admitted. suspected stroke. So I was supposed to attend to him. So I asked him, to tell me what happened. And he said, oh, he had hypertension and blah, 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 blah. So I decided to educate him. So I mentioned aphrodisiac, and he was surprised. I said, is the spray too part? And I was like, is it an aphrodisiac sort of? And he said, yes. He sprayed it on the manhood and then he gets the erection. I said, yes. It's equally part. And he said, oh, he's been using it for about 15 years. He switched to the spray because he thought that the oral one didn't help him. Because the first time he took the oral one, he had severe headache and serious palpitations. So he stopped. Then he went in for the spray, and then it was much better. So he continued until he had that stroke. We had transient ischemic attack, the mini stroke. So he had it and he recovered in 24 hours. So it was the information that I gave him on the ward that actually drew his attention to the fact that the lifestyle he's in is the one predisposing him to developing a complication. Yes, so most people don't really know what happened. So we can't be too certain about positions.
Okay.
But we can say that when there are issues, when you realize that your body or the system is communicating to you, you adhere to it. Sometimes we ignore these warning signs, and at the end, we get ourselves into trouble.
Anyway, I'm not going to say what's in my mind. I will not say it. I will hold myself not to say it. You're listening to the Orange Health Lounge, and good morning to all my classmates from St. Augustine's College who wanted to listen to this program today. Guys, I don't know why you were so interested about listening to this conversation about stroke, but I'm sure the answer that has just gone by is one of the reasons why. Good morning to you, Sasha and Kalito. I see you guys on Facebook. You never cease to amaze me. Anyway, but Marilyn, you were talking about risk factors, and for people who have already been diagnosed with conditions like hypertension and diabetes, those are risk factors. And if somebody is obese, yes, those. But there are also people who, there's nothing. Like they're just there, and then it happens, right?
Yes. So if you don't check your blood pressure, you never know you have blood pressure, because we call it hypertension is a silent killer, because if you do not check your blood pressure measurement, you would never know. So if you're having if there is such a history in the family, there is a tendency of you also having hypertension, and there's so much stress. And we take too much cholesterol, we take too much fat. There is so much fat and oil in our food, and these are all things that can cause stroke. And we don't also rest. Everybody needs money. So everybody is struggling to get money. So the stress increases blood pressures a lot, and people think it's only old people who get blood pressure. But I'm telling you, as Patrick said, 13-year-olds are getting high blood pressures, even 15-year-old. Recently, we had a 19-year-old who had a stroke.
And they are not under any pressure.
They are not under any pressure, but as I said, combining oral contraceptives, because as Patrick said, he interviewed actually a colleague who had stroke, and one of the things, she wasn't having a high blood pressure, neither was she. Her cholesterols were fine, her sugars were fine, but unfortunately, when we interrogated, she had to do an MRI for us to even know that she had a stroke, because when she did a CT scan of the brain, there was nothing that showed that she had a stroke. So through the conversation, we asked her whether she was using contraceptives and other things. Then she said yes, she's been combining them. So these are all some of the factors that could lead to a stroke. People will wonder, how can cholesterol cause a stroke? So it tends to block. It's just like having palm oil in a pipe. So if we see how palm oil stays on the silvers when we cook them, that's the same way when you keep eating oil, fats in terms of meat from pork and all those things, too much of it and everything, it tends to stain in the blood vessel, and with time it increases and it tends to block the blood vessels. So as Patrick said earlier, there is ischemic stroke. So when there is that disruption in the blood vessel, because the blood what you call it, the artery that supplies the whole, the blood through the brain and everything, it's quite thin compared to the other parts of the body. So if it tends to block, then blood is not able to go to the other parts that controls eating, that controls speech, that controls, walking and all kinds of things.
So to all my friends who like the Soggy Food Association,
you should reduce it.
We should reduce it.
Yes, please. And also the time in which we eat. That's one factor, because sometimes we tend to, in the morning, my mommy has a principle that in the morning you should eat like a king, in the afternoon you should eat like a princess or a prince, and in the evening you should eat like a pauper. So depending on the activity or what you do, you should be able to control that. So if you are eating...
all these things we like are so that's nice.
Yeah, it's so nice. But you have control over your health. Because just as Patrick said, there are so many things. We have privileges to so many things, but it's up to you to take control of it, because your health is your wealth. If you're not healthy, how can you take care of your children? How can you do all these things? So you need to take control of your health. So you should manage what you eat and the time in which you eat it.
Okay.
Yes.
So I think it's about self-discipline. I think it's about understanding that you need to be health conscious, right? You need to be health conscious about what you're eating. But for someone who your foundation is to spot, stroke, fast, and I keep saying it slowly: spot, stroke, fast. If I mess it up, what's for? If I'm home or if I'm in public, and I see someone fall or something, what are the signs and symptoms that, for me, like the layman, I can pick up that, no, this person is having a stroke?
Okay. So, simply, these are just the warning signs and then the things you would see. So, spot, stroke, fast, foundation. So, the fast is actually an acronym to detect, yes. It's a warning sign to someone who is having a stroke.
Okay.
So if you find yourself in a public space and someone is having a stroke, these are the things that could lead you to, helping the person out. So F means face drooping. So face drooping. So most often, people who have had a stroke, you realize that there's a deviation in their face. So either their lip, one part is deviated. So these are warning signs. And then the person is not able to raise the arms, both arms at the same time. You realize that one is drifting downwards. Then it means that there's some weakness. So you consider that as an issue happening in the brain. Then the S is slur speech. The person have difficulty with speech.
Okay.
It tells you that there's something going on in the brain. So these three are cardinal warning signs that tells you that a stroke is about to strike.
Okay.
And T is time. Stroke management or stroke treatment is actually time bound. So it's time to act fast. So Spot Stroke Fast Foundation, our motto is you think fast and then act fast. So for you to think fast, it means that you need to actually understand the acronym to the warning signs. FAST. T simply means it's time to act, and you have to send a person to a healthcare facility for management. Research says that if you recognize these warning signs and you send a person to a healthcare facility where they can actually manage stroke, it means that the person's chance of recovering 100% within the first 3 months is very high.
Okay.
But the more you delay, the more the complications set in.
Okay, I'm gonna take a quick commercial break at this point. When we come back from our break, we're gonna let people know when to see a doctor. When you have some of these things, or when to just check yourself into a health facility. And as we're going to explain to you the importance of checking your blood pressure and how you should even check it. Like what are the things to note when you're checking your blood pressure and when you should check your blood pressure, how you should check, and the kind of device you should use to check your blood pressure. I'll be back after this quick commercial break.
Regular checkups can help find potential health issues before they become a problem. By getting the correct health services, screenings and treatments, you are taking important steps towards living a longer and healthier life. This is why at Prime Diagnostics in Healthcare, we strive to give you the best of health and diagnostic services. We provide services such as sperm count, liver function test, lipid profile cholesterol levels, kidney function test, G6PD test, cervical cancer screening, fertility profile, gonorrhea, hepatitis B and C screening, genotyping, sickle cell test, syphilis, candidiasis test, pre-marriage test, prostate test, hepatitis B viral load, HIV testing and counseling, diabetes screening, FBS or RBS. Why don't you locate us at Bomso Kumasi at digital address AK316-1041 or call us on 0243 360 282 or 020 256 1234. You can as well visit our website at www.primedecare.com for more information.
And welcome back to 107.9 Orange FM. You're welcome to the Orange Health Lounge. If you're just tuning in, you've missed a greater part of our wonderful conversation here this morning with Patrick, Marilyn, and Patricia, who are members of the Sports Stroke Fast Foundation, and they are also nurses at the Konfanoti Teaching Hospital, Kumasi's premier referral center. Kumasi's premier referral center. Good morning to you, Mami Rose. He says this is the first time you're listening to our show, and that it's second to none. Of course it is. This show, we talk about healthcare. If you've got any health concerns, we bring only the experts in studio, and they are here to answer your questions. You can send me a WhatsApp on 0548 501 584. You can even send it as a voice note, and I'll definitely read it out or play your voice note for you. So if you've got a question, you can definitely send it here on the Orange Health Lounge. It could be in Chi. If you've got any questions about stroke. Today we're talking about stroke, and it's one of the things that, it's one of the medical conditions that can affect an entire family if you don't prepare for it appropriately. Before the break, we were talking about how, like, the basic screening when it comes to stroke prevention. For me, the basic screening is how to check your blood pressure. So assume I'm a novice, which I am. How do we check blood pressure? Because sometimes you have, I don't see the guys who walk around checking BP anymore a lot, but you walk into most of our pharmacies or some of our clinics and they have a BP device there. What is the right way to check your blood pressure? And can you check it on any arm, or is there a particular arm to check it on?
So before you check your blood pressure, let's say you walked into a pharmacy or you walked into a room, you need to relax for like 30 minutes. And if you took a bath and you want to check it after bathing, you have to also wait for 30 minutes before you check your blood pressure. You should be in a relaxed mode, and you should put your arm on a table level to your heart. So most of the time, it's shown that the heart is more closer to the left, so it's good to check your blood pressure at the left side. But irrespective of that, you can also check it at the right. And you should be in a relaxed mode to check your blood pressure. You shouldn't, it's not as soon as you enter the room, then you check your blood pressure. You should be relaxed. And sometimes some of the devices, you need to change the batteries, because if you do not change the battery, it could also affect the reading. Okay. And again, also we have different arms. We have fat people, we have slim people like myself. So, so you should get the right BP cuff. So the cuff should be the right for the arm. Mm-hmm. So there are ranges. So you should use a pediatric or someone like me to check someone who is like twice my size. It would definitely give you a wrong value. And it's very important you know the right value, because if you don't use the right apparatus to check it, the right calf measurement, you would basically be misdiagnosed or be told that you have a high blood pressure, not knowing you have a low blood pressure.
So, Patricia, how do you tell the cuff size? I mean, for me, when I go, I say, oh, check my blood pressure. I don't know. Like, how do you check the cuff size? Like, should you tell the person, or should the person know already before checking you?
With some of the cuffs, the size are labeled on it. So they will tell you this size small, others is big, others is large. But you just observing, you can see that this cuff, when you use, is not going to help. It's very small for you. So at times it's by observation, and at times it's by the cuff. The cuff, it will have on it that is a size small, and so it's a pediatric cuff that you are supposed to use. This one is for the adults. They have all that on it. Yes, please.
So then, when you look, I mean, so the cuff has sizes on them. But if, let's say, I'm a large person, and you use maybe a medium-sized cuff on me, does it affect the reading?
Of course, it wouldn't be even if you wrap it, it won't end where it's supposed to end up to. If you have this big arm and then you're using a medium cuff, it wouldn't be able to wrap around the whole arm. And when you try to, you even press on the bottom and then it tries to read, you realize that it's not even, it's even read error. And you realize that it's actually not helping. Even you, the individual, the person that we are checking, you realize that things are not working out for you because it's not going as it's supposed to go. Yes.
But one of the most popular questions, since we're there now, is the blood pressure reading. You understand? At what point should I go like, oh, okay, this is normal, let me carry on? Or, you know, when they check it and it's this value, I should say, no, as for this one day, I need to see someone.
First of all, you have to know yourself. Because what will be high for me might not be high for
another person.
Sure. So you first have to know, if you've been checking your blood pressure, you know that when you check, normally your blood pressure is within this range. So even if it reads around 120, 130, 140, you know that this is the range of your blood BP. That is the reading. So first of all, you have to know yourself. The routine check is going to help you know the readings for your blood pressure. And then,
so with the blood pressure, so the normal blood pressure is for the up one, which is the systolic one, it's between 100 to 130. So when it's above 140, we call it, your blood pressure is going high. And the lower one is mostly between 60, it has to be between 60 and 80. So the average blood pressure, we normally say 120, 80. But when it falls between, myself, for instance, sometimes I get blood pressure of 90. So if I get a blood pressure of 90, I just need to hydrate. And it's a normal value for myself. So if you're getting a blood pressure higher than 140, 80, then you should visit the hospital. And what you can do is you should keep a tab on yourself. So if I check my blood pressure today, I can write it down so that the next time I check, I know that, okay, this value, it's going high. So anything going higher than 140, 80, you're at risk of having a high blood, hypertension.
So you should have like a diary of sorts.
Yes, please.
Right? You should have a diary of sorts. If you are health conscious, or if you want to make sure that your blood pressure is within normal range, it helps to have a diary to check your. And should you check your blood pressure at the same time every day, or you can check it at any time that you feel like? Because people feel like, oh, let me check it in the morning, or let me check it in the evening when I feel more relaxed. Because for someone like me, let me use myself as an example. It's best I check my blood pressure in the morning. Because if I go through my stress throughout the day, so if I go through, because I track my stress, not my blood pressure. So I have, I'm not wearing it today, but I have a stress checker. And I know it goes up and then it comes down. So I'm better off checking my blood pressure in the morning. If I check it in the afternoon, I'm sure it will way through the roof. So if you're checking it in the morning, it helps to check it always in the morning, just so that you have a fair idea what's going on of your normal range. Okay, but there's some people who say like they are afraid of the machine, no?
We get that a lot at the
Yes.
hospital. That's why I said you should be in the most relaxed position. So sometimes you can, you're not supposed to be moving whilst the blood pressure is being checked. So sometimes we talk to the person like, oh, don't worry. Like, bring sometimes even a conversation that she doesn't even need to answer, but smiling to, oh, you'll be fine. So you need to sometimes talk to the person.
The nurses do that.
Yeah, we do that.
Oh,
Yes,
so
I do that.
we
do that.
engage them.
Yes, so you need to talk to the person that, oh,
I thought all you
it's
do
nothing.
is found Sabra
Oh,
to check
no,
on
Patrol
you.
there. Yeah, yes, so you have to talk to the person so the person will be in a relaxed mood. And when the person is in a relaxed mood, then you check their blood pressure. Because if the person is scared or having anxiety, because like you said, the moment the person sees it, or even the moment the person visits the hospital, the person might have checked the blood pressure at home, but the blood pressure will be high because the person just saw it. So like we said, the person should be relaxed. You could have conversation or even show something on TV that would just put the person in a relaxing mood. Then you check the blood pressure.
So if you go to the hospital and you want to check your blood pressure, which is one of the first things that is done at any good hospital, I must emphasize.
That's true.
Please be as relaxed as possible. Allow them to take your blood pressure for you, and then that is the first step to getting the person who's even going to see you to know where you are at. If you know you already have a high blood pressure and you know your range, I think at checking your blood pressure, you must be interested in, okay, have I gone up my normal range or am I going down? Mind you, like they said earlier, hypertension is very quiet, it's very silent. Sometimes the only sign you may get is a small headache, which comes and goes. But that may be the only sign that you have hypertension. Let me use this time to advocate that please check your blood pressure at least once a day. At least once a day. If you have a positive family history for hypertension, it's important that you check it. And hypertension is very prevalent in our environment. You have about 60 to 70% prevalence of hypertension. So it's very likely someone in your family has hypertension. So please take care of yourself. Drink lots of water if you must. Exercise if you should. If you know you can exercise. And check your blood pressure regularly. This is 107.9 Orange FM, and this is the Orange Health Lounge. My name is Dr. Jima, and I'm here with Patricia, Patrick, and Marilyn. They are from the Sports Stroke Fast Foundation, and they are an advocacy group that is focused on stroke prevention among our vulnerable population. And they are also very experienced nurses who work at the Konfanochi Teaching Hospital. If you've got a question, you can send it on WhatsApp on 0548 501 584, or if you're watching us on Facebook, you can also drop your comments there on Facebook, and I'll definitely read it out for you. In a few moments, I will open the phone lines. You can call in and ask the question that you want to ask about stroke. Someone is asking, how do children get strokes since they are not stressed?
I actually wanted to add on to
Sure.
when you said, when you use yourself as an example, that the best time to check your blood pressure is actually in the morning, because you think when you are stressed, your blood pressure will go up. I think it is equally a good time to check your blood pressure, because stress is also a risk factor to developing hypertension. So if at your calm moment and you check your blood pressure and it is normal to you, then you also have to check your blood pressure when you are stressed, so that you know the value when you are stressed. Because at that time, you may be fine in the morning, but the stress will actually predispose you to developing the stroke. So before you realize, when we say hypertension is a silent killer, in the morning it was okay, but when you were stressed, it means that it has moved from its normal state, your heart activity has moved from its normal state to a stage where you can have either a stroke or any other medical condition caused by hypertension. So I think you can also measure it around that time to see, so that you find measures to distress. Now you are using a stress tracker. Yes, it's good. But when it is that high levels, what do you do? Do you need to wait till it gets to that level? Maybe there can be some defense mechanisms that you can put in place to ensure that you don't get to a level where your BPs will rise or to skyrocket and give you a stroke. So that's why most people will get a stroke unknowingly, because in the morning he was okay. So please, stress is one of the challenging risk factors that put people into developing a stroke. So you don't say entirely stress because the person is not having stress, then cannot have a stroke. No, it doesn't work like that. We may be having developmental issues with our blood vessels. So it's also a factor. It may not necessarily be that you have hypertension. Some people may be having rapid heartbeat. When we say atrial fibrillations, it can equally lead to a stroke, because when the heart is not able to pump all the blood into circulation, some stays in the heart chambers. Some may form clot. These clots may go round because and then get dislodged in the arteries in the brain. The person will have a stroke. We are not saying that the risk factors we are mentioning here is just the only risk factors that leads to stroke, but these are the major risk factors that actually cause stroke. So there's more to that. So it is time for us to read more on stroke, to know that stroke exists, and they know how to control it, and know how to check your blood pressure as well. You've mentioned some of the how to check the blood pressures and then the cuff sizes that you should use. I'll add on a few things to that, so that when you're going to buy your own BP apparatus or the device we use to check blood pressure, you know which one to buy. You may say, yes, when you're looking at the arm size, you are small, but the only thing that will help you is the bladder. The cuff has a bladder in it, like there's some rubber-like stuff in it where the tube is connected to. That one should cover your arm at least 100%. Like it should go around the circumference. It should be 100% equal, or 80%. So anything 80%, if that rubber part is able to cover your arm 80% of it, it means that it's appropriate for you.
And that rubber part is inside.
It is inside the cuff.
The cuff.
Yes. So if it is
the cuff is the material that
the
goes
cuff
around
is the material. You know, when is the material type? There's a portion where they've sealed, and like it's long. So one portion is supposed to cover your arm before the entire thing wraps it. So I'm talking about that small portion. That small portion should be able to cover your arm at least 80%. If it is too tight on you, you will be recording abnormally false high BPs, which will lead to misdiagnosis. If it is too big on you, you are going to get abnormally false low BPs. So the onus lies on you to understand the mechanism in it. Guys are checking BPs in town, just as you said. And they are using one BP apparatus for all.
To check for everybody.
And our mothers in the market too, they see themselves, they don't have time to come to the hospital to have themselves checked. So they use that as an advantage to check their BPs. But please, if you are here, if you are listening to us and you do that business, please get extra cuffs so that you could help our mothers and they wouldn't have it in mind that they have high blood pressures or low blood pressures when actually the fault is from the cuff size. So we should consider it as such and know the appropriate size of the cuff to use. Yes.
And if you're going out to buy maybe a BP apparatus for yourself, please buy it from like a medical shop where the person there can also give you the right kind of advice so that you know that, okay, I'm buying the right thing to check. And make it a habit of checking your blood pressure. After taking your bath or brushing your teeth, you sit down, you take your blood pressure reading, you write it down. Make it a habit, because when you come to the hospital, we want to even know, the situation with your blood pressure. How has it been? All right. So just make it a habit. Just make it a habit. I have a question from, it says, how do I know I'm having developmental issues with my blood vessels? And I can answer that question for you, but I'll leave it to you.
when it comes to developmental issues, sometimes at the early stages. So when the child starts to exhibit maybe growth developmental problems, or having issues with walking, having issues with swallowing, having issues with their sight, sometimes there are investigations that are done, like the brain CT scan or the MRI. That one will help us rule out if there's any abnormality in relation to the person's blood vessels. So that's how we would go about it. It's not like when you are in the house, you could just look at somebody's face and know that this person is having developmental or vascular issues in the brain or even in the heart. No, it's a medical doctor who is supposed to assess and then do the thorough investigation to rule out or to actually confirm whether there is something like a developmental issue in terms of blood vessels.
Okay, I see. If you're just tuning in, this is 107.9 Orange FM, and we're having a conversation about stroke with the members of the Spot Stroke Fast Foundation here in Kumasi. One of the other things you can do for yourself when it comes to making sure you're healthy is doing your annual medical screening. And your annual medical screening will involve your cholesterol testing, your liver function test, your renal function test, for instance, and sometimes they'll do cardiac enzymes for you. But the most important thing is for you to do an annual medical screening, because something like a high cholesterol creeps up on you. And I've had patients who say, "Oh, doctor, you know, yeah, like, so how come my cholesterol is high?" Because I mean, I expect people who are big to have high cholesterol, and when you drill down to their lifestyle, you go down into their diet, you realize that no, this is the Kelewele and pork 10 p.m. Chibom eating, you know, thing. But sometimes it's just because of people's work, you know, especially nurses. I mean, some people eat at very odd times. Patricia, you know, you're going to work at night, and the only thing you can get is some very greasy food at night, and it becomes your habit. Yeah. You know, you work on the Bantima stretch. What are you saying?
I said you never know, because we the slim ones, for instance, maybe the things that I eat, it doesn't really show on my body. So
then you eat a lot.
So yes, I eat a lot, and maybe I might not be eating healthy. So if you don't check up, you never know what is really happening within. They always look at as the obese people. They are the one who are really like prone to certain things. But the routine checkup is really going to help you. Yes, that one is really going to help. So
it's important that you do a routine screening, a routine health screening. And trust me, if you do your annual medicals, it's not expensive in the end. Trust me on that. It's not expensive in the end, because and when you go to Prime Diagnostics this year, if you're more than 5 people, they're offering you a 30% discount on your annual medicals. So imagine if your annual medicals are going to cost you, say, 100 CDs. They're going to take 30 CDs off, and that's 70 CDs, and that's good value for money. So thank you, Prime Diagnostics, and they're running this till the end of the year. So you still have about 2 months to go. Hey, the year's already ending. You still have about 2 months to go. I have no idea where this year ends. It started from January, and suddenly, boom, we're in October. So yeah, it's one of those things. But I mean, for anybody who has seen a stroke patient, one of the most remarkable things, or one of the most obvious things, is their gait. I don't say gait, but how they walk. You would instantly realize that they are not moving one part of their body. A listener wants me to find out from you, is that, you know, the hemiparesis, is it something that can be stopped or cured when somebody has a stroke? Because what he sent was that so his mother has got a stroke on the right side, and he's saying that the challenge for him presently as we speak is that it's been over a year, and she cannot lift the hand, and he wants to know that is there anything that can be done to sort of improve the situation?
Yes, there's a lot that can be done. I think the recommended thing to do is to get a qualified physiotherapist, to help the mother do rehabilitation.
Emphasis on qualified. I like that one.
Please get a qualified physiotherapist to help your mother with rehabilitation, or occupational therapist, which you can find them in our prestigious hospital.
Yes,
So, I mean, that's what you need to do, you know. And sometimes the delay in recovery or getting the person back to normalcy, it depends on the time the person gets to the healthcare facility. I mean, yesterday I read on something that the person had warning signs, but the best the person could do was to go to a church premises to pray. So that one, the damage has already happened, and it has worsened till the person got to the hospital. So when you start rehabilitation, it takes quite a long time. And if you don't get a professional, a qualified one to do it for you, please, it may take a long time, because, and then the patient too should psychologically be prepared to undergo rehabilitation. It comes with some pain. So sometimes the physiotherapist too may have some challenge. So the family members should psych the victim as to cooperation, so that the progress will be seen well. So they should get a qualified physiotherapist, and then they should adhere to the medication too. Because when you have a stroke, you can have another stroke. It doesn't mean that once you have a first stroke, that is all. No, yes.
So when you have one stroke, you can have another stroke.
You can have another stroke. Because if the risk factors are still present and there's nothing being done to manage them, that means you still have another chance to do. Because the vessels, it's not only one. There are a lot of blood vessels, and each of them can, get occluded or ruptures in the brain. So if the person, is not managing the risk factors any longer, then there is a problem. The challenge Sports Stroke Fast Foundation has been, facing is that when we do outreach and then we interact with them during the counseling time, we realize that most of them will stop taking their medications, especially the antihypertensives and then the antidiabetics, the one to manage the diabetes. Why? Because they believe they've taken it for a long time, and it might be cured by now. But please, these conditions are not curable. They are managed with drugs and lifestyle modifications. So please, your mom should adhere to the advice the healthcare providers have given, and I'm sure with time they may see progress.
And I would emphasize that if you're having any challenges with your medications, don't be afraid of your health practitioners, like your doctors and your nurses. Ask questions when you go to the hospital. It is your responsibility to ask. It's our right to tell you, but when we look at the load of people, sometimes, when it comes to consulting, it's like there's no time. So you should ask the questions. Maybe you are taking this kind of medication and you think this hypertensive drug you're taking is, you're having headaches or you're having dizziness or whatever. Tell your doctor about it. When you tell them, they change it for you. And as you said, adhere to the medication. When you keep taking your medications, you wouldn't get these, you won't get stroke and you wouldn't get complications of hypertension. Then again, when we're talking about, she talked about the power that the mom has and all that. There are other complications that comes with stroke. So if she doesn't start exercising now, she doesn't get a qualified physiotherapist or occupational therapist to help with the exercise. With time, that particular side that is affected hardens, so it's contracted. It's difficult to open up, and there is so much pain. So it's better to start early. With the physiotherapy. Then again, with people with stroke, imagine if you are so energetic walking around and all of a sudden you have a stroke, especially with hard-working people. Then if you get a stroke, it causes depression. It causes clinical depression. So you should have the willpower and also have a positive mindset, because you can recover from a stroke. It's not a death sentence. But when you don't take care of yourself and also adhere to the medications and do the physiotherapy, then you get the complications, such as even getting a DVT, that is a deep vein thrombosis, because when you're lying down and for a long time, you develop clots in your blood vessel because the blood is not able to circulate properly. Then again, you could also get a brain edema because there is immobility and all that. Again, I would say that as I said, you get shoulder pains because there is pain when they are doing the exercise because it's been a long time since you exercised that particular muscle. And when you're having, the tubes, you are bedridden, there's a very high risk of you getting bed sores. So the bed sores are not only had in the hospitals. You can get bed sores even at home because they are not turning you left, right. So, and it's difficult. It's very difficult. So I would also advocate that our relatives who are taking care of stroke patients should have patience for them because it's not easy to suffer a stroke. It's not easy at all to suffer a stroke.
Especially when there's a cerebral component and the person cannot take care of themselves well
anymore. Because the person becomes like a child again. True. So you have to bath the person, you have to feed the person, and all those things can lead to, all those things are not easy.
People do get, you can tell sometimes when you're in the hospital and taking care of patients with chronic conditions like complications like stroke, and you can clearly tell that the caregiver is tired. Like the person who is taking care of them is tired, and that sometimes even worsens the situation. But Sports Stroke Fast is saying, like, don't get tired. It's important to understand what the patient is going through, and that may give you an idea of the kind of compassion that you should also have, because it's still no fault of theirs. No. That they've gotten a stroke. It's just still no fault of theirs. It has happened. And I would want us to go through the complications one after the other because of I want people to understand, But I want us to also answer James's question, and he's saying that he's been taking an energy drink every day, and he wants to stop, and he needs help, and he wants to know if it's good for the body. There are plenty of energy drinks on the market.
So much.
I'm not going to mention anybody's brand if I get sued.
There could be a reason why James really wants to stop. I'm sure he's heard, health care provider talking about the effect of these energy drinks. Yes, they are fortified with glucose and some caffeine to give you some...
Lots of caffeine.
Lots of caffeine. In the interim, you may have the good effect of the glucose, but the later effect of the caffeine will predispose you to developing medical or chronic conditions like hypertension and diabetes, which is causing most of our medical complications in the hospitals.
True.
So, James, yes, you can stop it by increasing your water intake. Increase your water intake. That would be the good thing for you to do. So the drive of taking, let's say, the energy drinks, when it comes, please do well and take water instead of the energy drinks. It will help you.
That's true. That's true because for those who take a lot of energy drink, you'd admit that after drinking it, give yourself about 10 minutes, you start having palpitations, and next thing you have a headache. And people used to drink like 4 or 5 cans or bottles a day.
I don't know whether these are commercial drivers are listening. In fact, they misuse. I don't want to use the word abuse, but it's sometimes they just grab it and within 2 seconds they are done. Then the next move they are taking another one. Sometimes I try to advise them, but it's difficult to change the mindset of someone who has used something for a very long time.
But caffeine is also addictive.
Of course.
Yeah.
So, so that's the challenge. So Sports Stroke Fast is here to encourage you. If you really want to stop, we will guide you, give you the information. Because the information you don't have, that's what led to the addiction. So if you give you the good information and you also make up your mind that, yes, I really want to desist from these things or reduce the intake of it, I think once you've made up your mind that you reduce it, you are halfway through to stopping it. So I think it's a good thing that...
Barry says that Marilyn mentioned oral contraceptives. Marilyn, this one, you have to explain to this young lady. You and Pat, you have to explain to this young lady why.
I don't really take contraceptives because I'm a man.
No, because
But,
now oral contraceptives are more common.
Yes.
Especially the emergency contraceptives are more common, and the last time I think I had a shock of my life when I walked into a filling station.
Okay.
A filling station, and I got to the counter, and I saw a box of emergency contraceptive pills, like for sale. So I asked the lady that, "Are you aware that this is a drug, and it has to be sold in a pharmacy, and it has to be dispensed by a pharmacist or somebody who is trained?" And she says, "Oh, because they are open 24/7, when people need it, and it's an emergency, you can come and then they will serve you." But Barry is asking me to ask you again that, are you sure that oral contraceptives causes stroke, and is there any number that that when you take will predispose you to a stroke?
Okay, so what happens with the contraceptive is that when you take, especially the combined, oral contraceptives, and you have risk factors, like the person smokes or the person is hypertensive, then your chances of having a stroke. You see, the contraceptive itself doesn't really cause a stroke. What happens is that it will first cause a problem like DVT or deep vein thrombosis. What happens is that the contraceptive causes something we call coagulopathy. It takes your blood, and then the likelihood of your blood clotting is also very high. So when you take more than the prescribed dose, it can be prescribed. So some to self-medicate. So the effect is actually seen in those who self-medicate because they want to prevent pregnancy. And when they take it, they take one and they are not too sure of themselves, then they add on, then they are not too sure of themselves, then they will take another one. In that case, you have taken more than enough for the year. I think I read a document which has been saying that you should take at least once in a year. If you double it up, it means that your risk of developing a clot in your blood vessel is very high. So, sometimes I always say that with time, we may advocate against these oral contraceptives with time. If technology wouldn't come in to maybe modify it or modernize it in a way such that the side effect of developing clot in the blood vessels will reduce, then it means that we are in trouble. Our women are going to struggle a lot in the future. So oral contraceptives, yes, it will lead to clot formation, and this clot will move through the blood vessels, and it can get to the brain and get block the blood vessel, and then you have a stroke. So it's not like a direct link to stroke, but then clot formation will take place, or the blood will take in before the stroke will occur.
If you're just tuned in, this is 107.9 Orange FM, and this is the Orange House Lounge. And this morning, we're joined by members of the Sports Stroke Fast Foundation, and we're talking stroke, everything stroke. I'm going to open the phone lines now. It's 24 minutes past 9. If you've got a question, it's time to ask now. You can also send your questions by WhatsApp if you want to. You can call us on 0541 022 318, 0541 022 318. If you've got a question about stroke, if you have someone who has gotten a stroke and you need more advice on it, where to find help especially, it's the time to call us. 0541 022 318. Since you guys are Konfanoche, Pat, someone wants me to find out from you, where is the stroke unit in Konfanoche? And okay, let me pick this call and then I'll come back to you. Okay, the call dropped. So he wants to know, where is the stroke unit in Konfanoche and how Like, does it function? Can you just walk in and say, I want to get seen? Okay. I don't know what's happening with the phone lines. The call keeps coming and it keeps going. Hello, good morning. Hello. Hello, good morning. Okay. Hello, good morning. Okay, so you can call back if you've got a question. 0541-022318. Yes, Pat.
Okay, so you can't just walk into Comfort Noche and then you be like, you have stroke, so we should admit you. It's either through the emergency or OPD. Okay. And even with that one, it depends on where you are at, how critical the illness is. Okay. So if after the doctor have seen you and then they realize that they have to admit you, because at the stroke unit we have stroke nurses who are well versed with it. So they have been doing the work, so they know how best they can really take care of you, it being mentally and then physically aspects of it. So the stroke units, when you come to Comfort Noche, we are at the D block, D4, right? D3, sorry. D3. That's the D3, yes. D3. So when you come to Comfort Noche and then you ask of D block, D3, that is where the stroke unit is. That's where the stroke unit is.
Okay, and you have to be admitted through the OPD
or the emergency.
Or the emergency. Okay, is the stroke unit only in Comfort Noche, or you have stroke units in other hospitals?
So there are stroke units in, most hospitals, especially the teaching hospitals. So there are stroke units. Even in some of the district hospitals, there are stroke units because there are neurologists and there are stroke nurses or nurses who take care of stroke patients. And like she said, you have to see the signs. As we mentioned earlier, is the face dropping? Is the arm weak? Is the person having a slurred speech? Because you just don't say, oh, I'm coming to the stroke unit. You should, is the person needs to show those signs and those signs so that you can come quickly to the emergency.
So the stroke unit is for rehabilitation or is it for treatment?
It's for treatment. So patients who are having stroke, so they had a stroke and they were brought into the emergency, as we mentioned earlier. So that means that the stroke probably just happened. Yeah, it's not like a 10-year-old stroke. Oh, we have old stroke. So if the patient is not able to swallow or it's having there can be stroke on stroke. So the person that had a stroke before has recovered or didn't recover completely, like we mentioned, that there are vessels, so it can affect another part. Maybe it affected the right. It could even affect all the arms. Okay, so if the person gets that again, the person is admitted to the emergency and comes to the medical block. So D3 stroke unit, that's where we take care of patients who are suffering from stroke. So it can be either a newly diagnosed stroke or an old stroke. Okay. Yes, so it's a holistic care. So it's not just the nurses and doctors. As we said, the physiotherapists, everyone is involved.
Everybody is involved.
Yes, please.
Okay.
So you thrown a question that someone will walk in and then tell you he or she has stroke. So what will make you know that the person has stroke? As we gave the acronym FAST. So if you are with the person and then you ask the person to smile, you realize that parts of them or like parts of the face is drooping or is tilted in a way, then the A is the arm. You tell the person to raise both arms. You realize that the person feels very heavy. He's not able to raise both arms. Then it's cautioning you that you have to take care. Then we have the X. The S is for the speech. Then you just realize you ask the person a question. Then the person is like, he or she is having difficulty trying to talk. Then that means that, yes. Then the last part is the time, the T. That means that it's time for you to bring the person to the hospital. Then we will take over.
All right. We're in October, and October represents everything pink. And in October, we ran our campaign on breast cancer awareness in both males and females. And next week, Saturday, here at the Kumasi City Mall on 29th, Saks Clinic here at the Kumasi Mall will be holding a breast cancer screening. So you should be here. I'll be back to tell you a bit more, and we'll continue our conversation on stroke after this short commercial break.
Hello and welcome to another episode of Breast Cancer Awareness Tidbits. This audio series is brought to you by the kindest courtesy of Orange 107.9 MHz, Kumasi's music leader, and powered by Sachs Pharmacy and Clinic. Please note that information in this audio is factual and has been cross-checked by health experts. In today's episode, we take a look at breast tumors. Tumors in general are masses or lumps of tissue that may resemble swelling. Breast tumor, scientifically known as fibroadenoma, is a non-cancerous breast tumor that most often occurs in young women. Not all tumors are cancerous, but it is a good idea to see a doctor if one appears. Women of reproductive age are most likely to experience it. In your regular breast examination, you may feel a lumpy, firm, movable, or a swelling in your breast. It may be in one or both breasts. When you notice this, don't panic. Quickly see a doctor for examination and diagnosis. Breast tumors can effectively be treated. Also, having a breast tumor doesn't necessarily mean you have a breast cancer. The tumor can be declared cancerous only after histopathological studies by doctors. We'll end here and continue in the next episode.
Orange 107.9, Kumasi's music leader.
Yes, and in October, we talk about breast cancer, and breast cancer can affect both men and women, and it's something that you should be aware of. We have just a few days to end October. As you wait for your bank alert for your salary, you should also remember that breast cancer is real and that you should get examined. If you are at risk, okay, that if you have a positive family history of someone with breast cancer, you should take October and every other month seriously for that matter. But if you have no idea what that is, next week here at the Kumasi City Mall, I think we'll be having an outdoor show next week. I'm not sure yet. Next week here at the mall, just come around. Our partners, Sachs Pharmacy and Clinic, will be here with a beautiful team of men and women who privacy is 100% assured, and we will be running free breast cancer screening next week Saturday here at the mall, and this is in partnership with Kumasi's music leader, Orange FM. 0541-022-318 is the number to call if you've got a question this morning about anything that we've spoken about stroke. You can call us and ask your question. 0541-022-318. That is the number to call. Earlier, we mentioned something about what we call the mini stroke, a transient ischemic attack, and someone just sent me a message. He says his name is George, and he says he's 33 years old, and I want to read out the message properly. He said last year he had just what your colleague mentioned. I had what they called a mini stroke, and okay, he says yes, last year I had a mini stroke, and I recovered. I'm well now. I don't have any challenges now as we speak, but I'm worried it may come back. He says I don't drink alcohol, I exercise quite often, and I don't eat after 7. So I'm surprised about this mini stroke. Can you please tell me more about this?
Transient ischemic attack. That's what we know as mini stroke. So the risk factors we mentioned actually lead to a mini stroke. But with a mini stroke, it takes quite a short time to recover, and the person can recover fully. The challenge is that once you have a mini stroke, your chance of having a major stroke is about 10 times. So all that you need to do is to adhere to the management of the risk factor that led to the transient ischemic attack. So yes, there should be a worry, and the worry should be a positive one that is geared towards the management of the risk factors that you were told of. So please keep exercising, keep eating healthy food, keep up with your doctors and your nurses and ask questions, read more on it, and then adhere to your medications as well. I'm sure you may avoid a second stroke or the major stroke.
0541 022 318 is the number to call if you've got a question about anything that we've mentioned today. 0541 022 318. That's the number to call if you've got a question about anything that we have mentioned today. And coincidentally, next week, Saturday, is World Stroke Day, isn't it? Are you doing anything special on World Stroke Day? Yes. Okay, so tell me about it.
So we'll be at the Yenyaosu Presby Church on the 30th on the 30th of October to do free screening and also to talk about stroke at the church. And also, so from 8 to 3 p.m. we'll be there. It's free, whether you attend church there or not. You could pass by to get a screening done.
Where is Nenya? So I don't know where it is.
Dichemso.
Where?
When you get to Dichemso. Opposite Plaza.
Opposite Plaza.
There's a junction opposite Plaza that leads to, I think, Moshizongo. No. You can pass there to Kenya, join the Kenya road.
So it's around Dichemso.
So it's around Dichemso.
Okay.
And let's laugh that crow from.
Okay, so you're doing a free
screening yes,
there.
Please. Yes, please.
From 8 a.m. to 3 o'clock.
p.m. Yes, please.
That's interesting. Just pass. Even if you don't attend church there, come there.
Yes, please.
Or you can come there after church.
You can come there after church. You can come there after church. So whether you attend church there or not, whether you're a Christian or not, we'll be expecting you. Just walk in there.
I mean, and that's a good thing. I mean, this is free. So if you are listening, I mean, mark it on your calendar and try and pass by, get screened. It's always good to get screened and know that there's nothing wrong than to be surprised. 0541 022 318 is the number to call if you've got a question about stroke, if you've got a question about any of the things that we've mentioned this morning. I think it's important that you clear it up for yourself. And so for a lay person, okay, I've listened to the show, I've gotten some education about stroke. If I see someone having a stroke, or if I'm with someone, I'm at home and someone is having a stroke, what can I do?
Rush the person to the hospital, the nearest hospital. Don't hesitate. You shouldn't be afraid. So if you're seeing all the signs that we have mentioned, the most important thing is to get to the hospital on time. So if you get to the hospital on time, we'll be able to save the person early so that it wouldn't, should I say, get worse.
Worse.
Yes,
okay.
So you should just send the person to the hospital.
Any hospital?
Any hospital. Because wherever you send them, they would send the person to where the person needs to be.
Okay.
Yes.
So, you should know, one of the things that you should always know is where the nearest hospital is, where you live. Because you never know what may be happening. And it's important that when someone is having a stroke, don't try and do anything funny. Just get the person in the safest possible mode and transfer the person to hospital. I think that's the best you can do for that person, because within a couple of hours, or let's say 4 hours, right?
Yeah.
3 hours,
3
right?
hours.
Yes.
Okay.
The person can receive some help. But I want to just dwell a bit more on your foundation. So what supports or what kind of mechanisms do you have in place for people who have had stroke, and do you offer any assistance to them?
Yes, we do.
Any of you can.
Yeah, we at the moment we are not in, we are not financially resourced to provide, most of the basic things they'll be needing, like
cash.
Wheelchair. Some of them may need some wheelchair support. Some of them may need some commode. Some of them may need even food to help them. We are not in that stage yet. But what we do is that we give them the nursing care they need. So we teach the relatives what to do, how to even position the patient to prevent aspiration, how to turn the patient every 2 hours, how to give the person water to drink, how to use the NG tube. There are some they can't swallow, so we pass a tube through their nose to their stomach. They use that at home. So we help them in management of the tube and then feeding of the patient. Some too, they have some catheters in situ. They are supposed to have something they will pass urine through, because the urine can equally lead to or increase the risk of the person developing sores at the back. So some of them are having. So we give them that nursing support that they need. That's what we can do for now. And then continuously educate the relatives on the need to equally get checked, know their risk factors, and protect themselves, because it's known that close relatives or, like you said, family history, they stand a high chance of also having a stroke. So we do this education periodically for them, and then the nursing care, and encourage them to adhere to review date. Sometimes they may be in the house and or they see that the patient the person is not coughing, is not having high body temperature, everything is fine, so they won't come at all. Or some to prioritize their work to the patient care needs. So we do this to support them and remind them constantly to visit the hospital again, so that if there's a need to do some tests, or if there's a need to even reduce some of the medications they are taking, we do that for them. So that's the support we give at the moment. But we are hoping in the future, if we get support, we get people, corporate institutions who, like the idea of, creating the awareness and letting people know about stroke. Yes, with time, we should be able to possibly even establish a very good, stroke facility where we can be managing those who have had a stroke, and then get good care for them.
Because I sometimes seem to feel that the person has had a stroke. It's been 5 years, 6 years, 7 years. Like, it's the same. Nothing has changed, and people really don't see the value in bringing them to hospital again, because they're like, yes, you hear that a lot. For someone who is listening, who may who may be thinking that, what do we tell them? Because sometimes they've just had enough. They've just had enough.
So it's actually not the same. It depends. It might not be the same kind. Like we said, we're supposed to do examinations. So when the person comes back to the hospital, examinations are done. So we do a laboratory test to check the kidney, how the kidney is functioning, how the liver is functioning, the blood, to see what's going on. Because, the person can also get a kidney or even a heart condition. So it's coupled with a lot of things. So when the person comes to the hospital on time, or the person visits the hospital frequently, please don't get tired. We know it's difficult. Difficult it is, but the person needs your support, because when that when the relatives get that support, or when the patient gets that support, the person fights to get better. Because if you don't have a positive mindset, it's difficult when you have a stroke, because that could cripple you, and even that could lead to your death. Because when you're too sad and all that, it could lead to your death. And as we mentioned earlier, the complications, because you will not see the complications, because even whilst you are feeding, if you don't feed the patient well, it could enter into the windpipe where the person is supposed to, breathe in and out, and that could cause aspiration pneumonia. So it's the doctors, is we the health personnel who would see that the person is developing maybe a pneumonia and will be treated. Maybe the person is having a urinary tract infection. The person is having an infection and it could be treated. And if the person keeps lying down in the house and you're not turning, because when you get tired, sometimes it's even the infection that will kill the patient, not necessarily the stroke. So it's very important that you visit the hospital. And also don't wait till your review date. When you see that the person is having any symptoms or is complaining of headache. Sometimes with stroke patients, some of them cannot even speak. So when you're seeing the person is having temperatures and all that, just rush the person to the nearest facility to get care. So
the point is not to delay.
Not to delay.
Don't delay care for the patient, because. Sure, go ahead.
I must say, caring for a stroke patient is tiring. It's draining, and you need that financial support. So sometimes they are not tired because they don't want to care for the person anymore. They are tired because they don't have the money to support the care of the person. So they may be wishing,
death.
I don't want to say it, but sometimes some are bold to say it.
I'll say this for you.
Sometimes you hear a whole lot of stories, like sometimes when we do, visit, the team, when we go out there to check on some of our patients, then they whisper into our ears, you understand? But I've seen people, who they are well-to-do, they have enough money, and they even had stroke that we even thought the person may not cross a 72-hour period. But surprisingly, they are doing so well because they had enough support financially, family support, friends, their workplace. Everybody was on board. So caring for stroke is just a multidisciplinary action. You can't just leave it in the hands of one person. No. So what we've realized is that when someone had a stroke, the first 2 days you get a lot of people visiting. 1 week it will reduce. The third week you realize that it's either the spouse and the kids, or maybe the son, or one person is actually caring for them. And when it happens this way, a lot of stress on them. So they will give up.
Yeah.
They will give up. That's why Sports Stroke Fast Foundation, we are saying that prevention is key. If you are able to note these risk factors and work accordingly towards them, that we wouldn't have any complication in that regards, then we will all be safe. No one will be burdened. You wouldn't have any cause to complain of stress because there's no one who have had a stroke, and we all live happily. Sure.
If you're just tuning in, this is 107.9 Orange FM. You've missed a lot of the conversation. Where have you been? We're 10 minutes to 10 o'clock. We're 10 minutes to 10 o'clock, and we're talking stroke and stroke prevention. If you have a question, you can call us on 0541 022 318, 0541 022 318. If you've got a question about stroke, you can call now and we'll answer the question for you. And like I said earlier, after lung cancer, breast cancer is known to be the leading cause of cancer death amongst women here in Ghana. A woman's risk for developing breast cancer increases as she gets older. Although rare, men can also get breast cancer too. There are over 3 million breast cancer survivors, and you can be one of them too. And early detection is key. So join Sachs Pharmacy on 29th here at the Kumasi City Mall from 9 a.m. to have your breasts checked. Feel for lumps and save your bumps. And this is proudly brought to you by Marie Stopes Ghana, Hollard Insurance, Ice Cafe and Grill, as well as Kumasi's music leader, Orange FM. So next week, Saturday, I will be here to have my breast screened professionally. By the team from Sachs. And next week, we'll be talking about breast and breast cancer. And for me, it's very personal to me because I have a positive family history for breast cancer. So I do not take breast cancer lightly at all, as you also should. But if you've got a question about stroke this morning, 0541 022 is the number to call. You can send your questions in and we'll definitely answer them for you. And Maximus is asking me to ask you whether there are private, I'm not too sure, whether there are private hospitals that only take care of stroke patients in Kumasi.
Sure about that,
yeah,
but I'm aware of private rehabilitation centers where they can help with their physio.
I think that I think the question he wants to ask actually is that, you see, when are there private nurses who can come into your home and take care of your relative, or a private physiotherapist who can come into your home and help you with the rehabilitation of the patient? Right?
Yeah.
And he wants to know if those people work through your foundation. That's what he's asking.
Well, sometimes we can advocate to be help or support to family members who need our support. Sometimes it depends on the distance too. If it's just close, we could get one of us to be assisting the families to do their stuff. But yes, we know some group that do health home care services. We have not yet established yet. So maybe with time we will do that. But if they need that support, we will look around and then get them good nurses and then good doctors who would
I think it would be good for a foundation to take that up, to start doing some of these linkages, and you pay me a consultation.
Yeah, I mean, we have a big plan, but like we said, we don't have support.
You
like,
start
financially. So now that we are,
the support to come.
Now that we are, I mean, so we started, like we said, we go to their homes and then see them and then, I mean, help them with the needed support that they need.
Yeah.
So now that we realize that people are calling in for, then it means that the team should re-strategize going forward. After here, we'll just meet and see if we could add on to that.
Yes, because so I think that for you are trained in stroke care, and you're going to be paid for it. So that people are not going to get tired, because I feel that people they just get tired of doing everything for this adult who has now become like a child, like a child. So, I mean, that is there. We have just about 8 minutes to leave the studio. So, if you have a question, you can call us on 0541 022 318. I think we were joined by a fourth member of your team. If you can introduce yourself. Do you want to? Yes, you can just introduce yourself here.
I'm Samuel Ejay Sapon.
Samuel Ejay Sapon.
Yes, please.
Okay. Yeah, a member of the Sports Stroke Foundation. Okay. That's so. We have the whole team.
We are actually a lot.
Yeah, a lot.
Yeah, we have some in the northern region, some in the Bunahapa region, some Ashanti region, like different hospitals.
Okay.
It's something that we think people should just join.
Okay. So do you provide like training as well?
Yeah, we provide training.
Okay, like for nurses.
For nurses.
And doctors.
And doctors.
Okay.
Because it's not everyone who knows how to manage stroke. We might be hearing it, but the in-depth of it may not be there. So give them, materials, give them sites where they could read on more to add on to their existing knowledge. So that's what we do. So we have a lot of, healthcare workers joining the team. Yeah.
So Frederick is asking me to ask you, Frederick, your question is not clear, but let me, I'll paraphrase. So he's asking me to ask you that, like, is stroke care expensive? Like, he just wants to know that are the medications and cares and things of stroke expensive? Because what he's asking sort of comes into sort of feel that, like, he wants to know if it's expensive to get a stroke. That's what he's asking.
Yes, so
costly.
It's expensive to have a stroke.
Yes, it's very costly when it comes to the medications and everything, because like we said, it's a holistic care. It needs a multidisciplinary team. It needs everybody on board, the physiotherapist, the rehab doctor, nurse, everyone. So even the medications itself, and it's not a one-day thing. You need to take care of the person like from day one, the onset. And some of the drugs are very expensive. And when you take a population, 1 in 4 people get stroke. So it's that terrible than even breast cancer in terms of the nature and also the number of people who get it, because we have over 40 million people dying of stroke each year. So we take it very personal, because you need to get to know about it and prevent it.
When you say is stroke expensive, yesterday I interviewed a stroke survivor, and she said something that struck me so hard. Like, it has taken away my happiness. And I don't know how much you use to buy happiness. To make you happy, I don't know how much you spend.
Oh, so I know how much.
You know how you spend. But when you have a stroke, how much would you spend to regain that happiness? Because people will not visit you anymore. Your money will be gone. Your friends, your plans, everything will just go away and stuff. So please, it's expensive. Apart from the financial issues, your happiness will be gone. Yes.
So Fred, that's the answer. It's not about the medications or the care. It's also about your personal well-being, like how you're going to integrate. But most of our public spaces are not stroke friendly, and somebody who has a stroke is I mean, if they get physical manifestations, like they have a disability, they have a physical disability, and many places are not disability friendly, many places. So how are you guys pushing for this? Because a lot of places, I can mention 1 million places that are not disability friendly. And I think at one time I went to a bank, and there was a stroke patient who was coming in, and he could walk on his own, but you could tell that this 3 or 4 stairs just in front of the bank is just not helping the person, and the slope is also too steep for the person, and it was quite a scene. So maybe we should find a way to get more advocacy in for people to just convert their spaces to be stroke and disability friendly.
Yeah, I think there has been that call from the disability group, and I don't know why sometimes we make it look like it's their fault being in that situation. Everyone could get a stroke. Everyone could have one issue or the other that will impede your movement to places where you enjoy the most. I think when we are to build, we should consider these things. I'm happy Orange 107.9 FM, Kumasi's music leader. Your place is disability friendly.
Right.
People could just come in even if they are disabled. I think we should learn from these things. I've visited people in their homes, and I realized that story building, they are on top. The person is not well, has to come down.
Yes.
You have to get macho men. This man is just in there with a wife. So please, when we are building, we don't even need the government to even come in. We should take it upon ourselves and ensure that and plan for the future, because anything could happen. Stroke, it just happens suddenly. So if any disability of that sort happens, at least there's a way out. So we should take it upon ourselves, and in our buildings we should.
Yeah, I have a good morning to you, Gibson. Thanks for always listening. I have a very good architect friend who says that when you are building and you want to be conscious of what you are building, build knowing that the house you are building, by the time your kids hit 25, 26, they're out of that house.
Of course.
So if you are building for yourself for the long term, build in such a way that when you have challenges, physical challenges, you'll be able to move around your own house.
Yeah, it's true.
That's true.
Yeah, you'll move around your own house, because if you have a story building and you cannot get up the stairs, what's the point in that? So, build to your comfort.
Yeah.
Build something nice and build to your comfort. We have run out of time, and it's 10 o'clock. We've been here for 2 hours. Can you imagine? And we've been talking to Patrick Camilo. He's the acting chairman of the Spock Stroke Fast Foundation, as well as Marilyn Mausi Azuma. She's a nurse at the Confounders Teaching Hospital. So as Patricia Osei Owusu, who's also a nurse and a member of the Spock Stroke Fast Foundation. Guys, any final words from each of you before we wrap up? Let me start with Pat. You haven't spoken a lot today.
Okay, so my final word, what I would say is that early detection saves life. So just as we are here educating and then creating the awareness, the more you get to know, the better it helps you, and then it saves life. And then as we gave the acronym, we are leaving you with that acronym, the FAST, that as you see those symptoms, immediately rush to the hospital so that it will save life, and then that person won't be a burden to you, and that person won't lose his or her happiness. So early detection saves lives, and then take good care of yourself too.
Great.
Yes, so I would add on to what she just said. So what I would say is that please check your blood pressures. It's very important that we do annual checks, and if your family have a history of blood pressure, just get a blood pressure machine and check your blood pressures. It's very important. And with people who are having stroke, or you see the symptoms in which we have mentioned today, please rush the person to the nearest hospital. Don't send the person to a church, a prayer camp to be praying or wherever. Please send the person to the appropriate quarters to get the immediate attention. And lastly, please, it's difficult to have a stroke. they need the support. They need us. They need all of us to help them to get better. So please, as much as possible, we should help to support stroke patients. And lastly, when you're building all-inclusive disability, we are all together. So please, when you're building, consider other people. Consider people who cannot walk and take the stairs and all that. Thank you very much.
Thank you. Yes, final words to you.
Yes, so Support Stroke Fast Foundation, we are here, and we are here to give you the best information you need to keep safe or to prevent stroke. You can visit us on our various social media handles. We are on Facebook, Spot Stroke Fast. We are on Twitter, Spot Stroke. And you can also sign up to our website. If you want any information, you can go to our website, www.spotstrokefast.com. You can have all the information there. If you need to contact us, our information is out there. You can send us an email. You can equally sign up as a volunteer or a partner in the future so that we'll meet and organize outreaches and programs for our people. It's for our people and for the country.
All right.
Orange 107.9.
And that brings us to the end of our show today. And we're here every Saturday between the hours of 8 a.m. and 10 a.m. here on Kumasi's Music Leader. My name is Dr. Kwesi Jima. See you again next week Saturday. Enjoy your week.